Polka town, located in the Goza local government area of Borno State, has become a focal point of intense fighting and insecurity. The town has witnessed the tragic killing of numerous civilians, the abduction of women and girls, town destruction, and widespread displacement. Livelihood has been shattered and asset looted, impacting a population that has doubled since the conflict began.
Da zama din ai ba ai makaranta ba, kawai ina zama ne haka lokacin duk an kona makaranta na.
Ba ruwa, ba asibiti, babu komai da enti.
Fatimatu and her mother lived in Polka town and endured extreme violence during the uprising.
Mudan gudu muka yi ni sunana Aisha Banha a Kirawa Najeriya. Shekara biyu mu haru da yara ba tukuna. Sai daga baya muna ji kishin suna sai mun je mu haru da yara. Din kwadi na zo nan ta farko. Yaro kuma daga baya ne kuma na je wajen mutane sun ce suna nan a Kamaru. Sai na aika mutum sai suka kawo mun yara. Tsakanin da yara wannan da shekara biyu tsakanin ba mu haru da su. Baban fari mutu wannan kuma shi kuma dama yana so ya gudu Kirawa. Yana wani kauye ne, ya tara kayan shi a Malanke zai gudu Kirawa da dan wanshi da mata biyu. Aka kashe su a hanya, aka kwashe kayan su aka bar gawa. An zo ɗiba gawa din ma an hana su, sun ce ba za ku ɗiba gawa ba, haka a can suka ruɓe. Shi ne abun ya kaɗa mini hankali gaba ɗaya. Shi ne sanadin na yana zama fako ne saboda yaran su samu ilimi kaɗan. Ni ma na gina bai yi makaranta ba, kuma in je ɗibi yaran je wani gurbi na ce garan hakura fako ne.
Tun a 2016 na fara zuwa makaranta, sai mun zo muka yi gudun hijira sai aka kai ni Kamaru. Can ma na je na jona da na yi class 3 sai muka koma zuwa Fulka nan. Duk an kona makaranta na. Ba makarantu ina zama haka. Mu samu mu je ɗebo ruwa, mu samu ko mu je itace, amma ina sha'awar makaranta. Amma yanzu an zo an gyara makarantu gaba ɗaya.
The Multi-sectoral Recovery Project, MCRP, implemented in Borno State has sparkled a light of hope and played a key role in bolstering resilience, especially in Polka. The MCRP focused on bettering healthcare, education, and WASH. These efforts were aimed at strengthening these critical sectors.
Actually, it's a 30-classroom mega school in Polka, constructed by MCRP. And His Excellency directed that 30-classroom mega school facility be used for Government Day Secondary School Polka. Interestingly, the first day we commissioned that school, 600 children turned up, day one. By day two, we had to send them away. 600 children who the day before were all out of school children, overgrown. They have completed basic education school and there's no access to a senior secondary school because the nearest secondary school is in Goza, which is like 23 kilometers away, in Bama, which is like 26 kilometers away. So it was a sigh of relief in that community when we opened that school.
Gaskiya mun ji daɗi. Makaranta mun je saboda me ne tun da muka zo hijira wannan. Ilfam ana kawo mu yaran mu ba mu sai ilfam ba, ana ba su takardu ana raba musu ba mu sai ba saboda Allah. To shine mun ji dadin ne. Kaga yaro bai je makaranta ba laifi iyaye ne. Su da kan suna gaya mana fa sun ce ko ina kun gudu muna bi ku da makaranta saboda ku karo da yaran ku ne. To sauran ba ku yi ba laifi gare ku ne. Kuma gaskiya zulmi yayi kokari fi sabilillah. Ko ina yana magana makaranta kuma mun ji dadi a cikin walada yanzu gudu da muna zama jeje kan ba asara ba.
With this intervention of MCRP project have helped in so many ways in terms of our education of our children. At the moment as I'm talking to you, our enrollment of students, we have a population of more than 1,000 students on ground. The intervention have gone a very long way.
So we're going to solve questions on the area responsibility as well before our time for break. Then we might come back later after break. Is that understood?
The situation before the intervention was very devastating because they were scattered, just living in a camp in the community, doing nothing. With this intervention now, we have even graduated one set of our SS3 students last year.
Amma yanzu an zo an gyara makarantu gaba daya, amma yanzu na fara zuwa. Na dawo makaranta in je Islamiyya. Na dawo Islamiyya in dan taimaka da su sharan gida, su hura wuta, wanke-wanke zuwa ɗebo ruwa.
MCRP has been a serious saving grace. When the first RPBA report, Recovery and Peace Building Assessment Report, that culminated to the formation of MCRP was published, number of destroyed classroom facilities in this state is over 5,000. And I can say the MCRP helped build back more than 40% of it, which is a very good thing. By the way, the books were given by MCRP also, 232,000 sets, uniform, bicycles. Then we set up the school. They have provided 48 laboratories in 22 schools, helped in equipping vocational training centers, built workshops for certain centers. So I can attribute a large percentage of the educational success to the MCRP project. And they have keyed into our 25 years development plan and 10 years strategic framework.
According to the MCRP Project Development Objective, PDO, and Interim Result Indicators reports as at December 2023, Borno MCRP alone has reached a total of 26 schools reconstructed or rehabilitated out of the targeted 36 to 55 base state targets as per the project document.
Farko wannan ruwa an ce baro muna riba nan ajata wani bayan gari nan. Sojoji suna gaya mana an kunje nisa Boko Haram zai tare ko. Akwai ran da sun zo mu sun zuba wani abu a cikin ruwa din. Sai sojoji suka hana mu shan ruwa din kwanan mu bi ba mu da ruwa. Kwanan mu bi muna transit ba mu da ruwa. Muna shan wahalar ruwa.
Everybody believed that it was a mystery to get water in Pulka. Everybody has already concluded that you can't get water in Pulka. But fortunately, with this project funded by World Bank through MCRP, Borno State government is able and fortunate enough to get water in Pulka.
Dukkan lungu shin gari dama ba ruwa. Daga shan gyara wannan ko ina lungu ana ba da ruwa. Hatta wani ango a can Salanda ware na garo yana yi. Muna sha muna wanki muna komai da komai.
Pulka Water Works is one of the best water interventions in the state. The project comprises the construction of 750,000 liters surface tank, 500,000 elevated tank at a distance of 3.6 kilometers within the town, with extensive reticulation within the communities. It has a centrifugal pump, 30 horsepower capacity, that pumps water into the community. Water is being supplied to that surface tank from solar-powered boreholes that were carefully identified, constructed in line with the geology of the area. Because of the high demand of water from the community, even passers-by normally saw the people in the community struggling to get water. You see young girls and women trekking distance up to about 10 kilometers sometimes just to get water. The risks of exposing women and young girls to various sexual harassments because they had to pass through bushes to go to some places to get water has completely reduced. And I don't know when last did you hear any issue of cases of cholera outbreak because of drinking contaminated water in Pulka. All these have now become history. And even the individuals, they were stressed to get water, but now that stress is no longer there.
This initiative ensured that the community gained access to clean water sources. addressing a significant concern that has existed for years in the community.
Ina so in zama likita. Ina so in zama likita don taimakawa maza da mata gaba daya. Irin wanda ko aikin sauri ne kuma ba su samu ba, na fi so ne zama haka in taimaka musu da sauri.
Sun ce ba asibiti. In mutum ya haifu ma da muna haifuwa gida akwai reza akwai auduga wanda da ba mu da shi. Mu karɓa yaro kai. In mai rai ya rayu, in wanda ba rai ya mutu abin shi. Sai mu ce Allah ne ya yi mana a sai rashin asibiti ne. Ba awo ba komai haka muna zaman gargajiyar da kawai. Yankin muna zama.
Before the intervention of MCRP, the situation was very bad. I can say it was very poor. Why? Simply because people were dying, lack of incentive drugs, like lack of proper management. We have no drugs to manage people by then. So really we faced a lot of challenges before the intervention.
Additionally, MCRP outfitted a primary healthcare center with medical equipment and supplies. To ensure sustainability, the project also built 1 and 2 bedroom units, staff quarters to accommodate medical personnel working in the facility.
In a daily basis, this clinic we used to see on average 120 patients daily. And the number of female is the one that is higher than the male. Almost we used to see 80 to 90 female, while the rest of the percentages is for men.
Asibiti yanzu alhamdulillah muna jin daɗi yanzu. Mata za su zuwa awo. Zan yaro yana musu matima ana gyara yaro a ciki. In yaro ko mace maman ba lafiya ma za a bashi allura, za a bashi magani don ya samu sauki. In sun haifi yaro za a dan basu dan barko, za a basu rigan yaro da hula, muna jin daɗi nan. Na yi rashin lafiya, na je asibitin Zulum. Sun samu drip, sun bani allura, na samu sauki na dawo gidana.
Really, in this facility, we carry all these services like immunization, antenatal, outpatient. We do manage it, and we do referral cases where we cannot manage it within the clinic. We do delivery. In fact, the MCR project has helped a lot. That is not to be counted or to be mentioned simply because they have rendered many service to this community, of which our people have enjoyed their intervention.
Before, people used to access, services either in Boza or in some situations they were transported either to Bama to access, healthcare services. But at least with the establishment of the primary healthcare facility there, some of the basic, health needs of that population as at that time, the facility there is addressing. And also the challenges of, staff not having accommodation. So that's why the staff quarters that was built there have equally, significantly improved in making sure that the healthcare workers are available and they are easily accessible. And so anybody that comes to the emergency is not under, is not doubting whether he's going to get the health worker there or he's not going to get the health worker there. So I think providing that accommodation as further. Part of the development, 25 years development plan of the state government, really assessing to make sure availability of healthcare services is very critical. And you cannot resettle a community without providing healthcare services. And so that's why you see that you continue expanding on that aspect. So that the part of the development plan is to ensure that at least we have access, availability, as well as the quality of care. So in terms of staff, in terms of equipment, in terms of infrastructure, and the basic needs that you need to put in place at that location so that they will not feel that at least they don't have access to healthcare facility. And it is in one of the strategic development plan.
The project, which aimed to reconstruct, rehabilitate, and equip health facilities, targeted a range of 27 to 38 health facilities across the Bay State and Borno. MCRP alone has reached over 25 health facilities, which consist of 21 comprehensive and primary health care centers and 4 tertiary health centers across the state.
Allah ya taimaka mishi masin da ya taimaka ma al'umma gari duka ba wai ni kare ba duka al'umma da Afirka nan shi gaskiya ya kokari Allah ya mishi albarka.
The MCRP intervention has not only rebuilt infrastructure, but also restored hope, stitched together dreams like impeccable patchwork, and restore a sense of normalcy for Fatima too, her mother, and thousands in Polka, with the following target achievement. Approximately 331,183 to 473,119 beneficiaries in the Bay State were targeted, of which in Borno alone, 221,088 were reached and now have access to service delivery infrastructure, with over 50% of the direct project beneficiaries being females.
A very big thank you. They have been serious partners in success. Without them, honestly, this feat cannot be achieved. So a very big thank you to the team. They have been a real saving grace.
So let them continue to support us. We are in critical needs, and then we still need their support and services to ensure that at least we continue or sustain the current momentum that we are going, or even surpass and expand on the current interventions that they are doing.